COVID-19 had made a very awkward in our country, like heavy increasing of patients. There is lot of increasing of COVID symptoms and also death also increasing. It's constantly. In many of the hospitals, there are shortage of ambulance beds. The peoples are sleeping in a floors and patients also sleeping in floor. Also, COVID test also held, and all the business are reopened in without taking physical distance. Railway also opened. All the dance clubs started. Mall also started. Gym also started. Is effectively. Very recently, all the festivals also held like Holi and Kumbh Mela. Election canvas also begins very hardly, and peoples without maintaining their social distance, without wearing their mask, they are standing and looking at the canvases. Like this, the COVID symptoms also spread. Because of this, the COVID again started.
You reach the hospital and it is absolute pandemonium. Patients, oxygen saturations dropping, patients getting ventilated, your juniors calling you to be in the ICU at that point in time. And inside the COVID ICU, it's a completely, it's a mind boggling scenario at times, especially at the peaks of the pandemic.
Some hospital, the doctors are not there to check up the patient.
So every day, the rise in COVID 19 admissions has been phenomenal. This is not something which we saw last year.
Bed and oxygens are very shortages and importing by other country.
हो सके सोशल डिस्टेंसिंग का पालन करेंगे सभी दुकानदार ध्यान दें
In Mike, they are telling to maintain the social distance to people. The peoples are not wearing that they are busy in their own things, and all the doctors are doing their duty by producing vaccines and expert tell like this.
The way the charts have climbed is really uh, quite amazing. We went from 10 million to 11 million cases in 66 days, from 11 to 12 million in 34 days, and 12 to 13 million in about 15 days. So that's very, very scary, that rate of change. Now, the question is what happened? If in January, if in December we were saying that enough number of people have been infected and therefore there is a downward curve, how can suddenly the same people become susceptible? The only logical explanation for this is that the virus has changed.
All the peoples are waiting for their turn to get vaccinated, and all the peoples are waiting like this without maintaining a social distance.
If we deploy vaccines at a large enough rate, then we will start shifting the pandemic. And there is scientific evidence for it. If you look at Israel, if you look at UK, the experience there shows that if you get roughly 40% of your population vaccinated, then you bring the pandemic almost to the baseline. Unfortunately, we are very far away.
Police are doing their duty, and lockdown also held very strictly, and it is good. And also peoples are moving towards their natives and taking a food and waiting for their turn to go. By waiting, the crowd has been occur. All the recorded had been started. The patients also getting admitted. Lockdown also statistically patients are waiting for doctors to their checkup. Some peoples are waiting by many times to get checkup and they're settling on a bed, and also other patients are not getting the medicines now because the crowd has been started, and also they're telling to stand outside and wait for the medicine.